Hello, everyone. I am Salim Virani, and I serve as Vice Provost for Research and Professor of Medicine at the Aga Khan University in Pakistan.
And I'm Kristin Newby. I'm a professor of medicine in the Division of Cardiology and a faculty member at the Duke Clinical Research Institute at Duke University School of Medicine.
So, we are so excited today to be talking about the 2023 American Heart Association and American College of Cardiology guideline for the management of patients with chronic coronary artery disease.
So the next thing we want to touch on is weight management in patients with type 2 diabetes. The use of either an SGLT2 inhibitor or GLP-1 receptor agonist with proven cardiovascular benefit is recommended. And in patients with chronic coronary disease and heart failure with an EF less than 40, regardless of whether or not they have diabetes, use of an SGLT2 inhibitor is recommended. And these drugs have shown some effectiveness in weight reduction, even at these diabetes and cardiovascular treatment doses.
I'll provide a very quick overview. It's extremely important that we measure BMI in all patients who are presenting to our clinics. And in some patients, the use of waist circumference may be beneficial as well. Once that's done, patients who have obesity, the first therapy that we have to do is really lifestyle therapy. And we know that works in good number of these patients. So that's a class 1 recommendation. Now, if lifestyle therapy does not work and we have BMI above 30 or BMI between 27 to 29.9, but patients have comorbidities related to obesity, then in those patients, we have the option of using medical therapy. And as we know, recently we've had a lot of data related to GLP-1 receptor agonists. So those could be therapies that could be considered. That's a class 2 recommendation. And there we have some head-to-head comparison between various GLP-1 receptor agonists as well. For example, we know that semaglutide is better than liraglutide in terms of head-to-head comparison. So those are recommendations that are there. Now, we also have a class 2 recommendation for patients who have morbid obesity or those who have BMI of more than 35 up to 39.9 but do not respond with at least a 5% weight loss to medical therapy that we just talked about. In those patients, actually surgery does remain an option. And that's again a class 2 recommendation. So in those patients where we have done lifestyle recommendations, we have done medical therapy, but despite that they have very high BMI or they have medical comorbidities with those BMIs, then in those patients, once these things are done, consideration for bariatric surgery is also there. And we know from observational data that bariatric surgery can actually improve cardiovascular outcomes as well as reduce the burden of these comorbidities.